Hello everybody. I'm going to talk to you today about the essential bad breath home treatment protocol. So this is what to do after we've treated you for bad breath. Upon awakening, first drink a full glass of cool water, and you can also sip several glasses during the day as well. That'll keep your throat moist, and that'll keep the bacteria at bay. After breakfast, there's going to be several things that we want you to do in the order listed. First off, use a metal tongue scraper on both sides of your tongue until the clear residue is gone. So picture your tongue like this. This is the top of your tongue. This is where your throat drops off. Want to use that tongue scraper as far back as possible and just remove as much of that residue as possible until it's gone. Then we want you to use the bent throat brush. So this is not bent right now. We want you to bend it. So that way you can get into the throat area right there. So that allows you to actually basically clean that throat area. You can kind of go back and forth there. And you want to do that for about 30 seconds, as far back as you can get. And also for 30 seconds like this, over the front. So that way you can clean the entirety of your tongue. We also want to note that you don't want to rub your tongue raw. That is too aggressive. Some people gag, especially when going back here. So what you can do is you can actually practice deprogramming your gag reflex by putting your finger or a brush in the back of your throat to gradually deprogram that, so you won't automatically gag all the time. The more you do it, the less gag reflex you'll have. After that, we want you to use gauze. So we want you to actually saturate 2 pieces of gauze with a chlorine dioxide mouth rinse. This is ProFresh. This is very, very good. And what you do is you saturate these, and then you take them and you wipe the back of your tongue in every direction for 10 seconds. And you want to repeat this 4 times, because every 10 seconds you flip it over, you do some more, get as far back as you can get there, and then you use the other one. Same thing, and repeat that. And you want to be aggressive with this. You can't really hurt your tongue with this, so be aggressive and really get down there into the papilla in your tongue. And you want to check in the mirror to make sure you've got your tongue pink all over, including the sides of your tongue. Because if you've got any white, any plaque buildup there, then you need to do a little bit better job here. And also, after that, we want you to floss. We want you to floss, and then also check the floss for odor and bleeding. So after you floss, you get your floss, and you can actually smell that piece of floss right there to see if you've got any odor on it. If you have any odor or bleeding, you want to definitely go back to that spot and irrigate longer using the sonic fusion. So we want to have you actually clean that area better. Also, here, talking about it, this is the sonic fusion right here. So we want you to actually brush and irrigate using the sonic fusion. It kind of does two things at once. It's got a water pick built into an actual electronic toothbrush right here. So we want you to actually use 1 tablespoon of bleach to the 8 ounces of water, or also you can use 3 ounces of hydrogen peroxide to a full container of water. And we want to have you start off on level 5, and then you can kind of work your way down to level 1 when you go over your tongue there on the back of the tongue. So you can still use this on your tongue as well. And we also want you to use the Macaulay powder. So this is very good. It's salt and sodium bicarbonate. It's very good at keeping bacteria from reattaching to anything. And we want you to put this powder on floss picks and focus on those odor or bleeding spots. Here are these soft pick floss picks right here. And these work very, very well. If you get them wet, dab it in the powder, and then you can go in between your teeth like that, especially in those areas that still have any smell. And then after that, rinse vigorously for 1 minute with that chlorine dioxide mouth rinse, and focus on gargling in the back of the throat, because that's where a lot of that bacteria builds up. And before bed, we want you to repeat the exact same regimen you did before or after breakfast right there. So that way you can actually just basically keep that bacteria from being able to build up, and that'll keep that bad breath at bay. During the day, brush with a tongue brush for 1 minute, and rinse with chlorine dioxide mouth rinse for 1 minute, swishing in your mouth and gargling also. This will kill the bacteria you have dislodged with a tongue cleaner and neutralize any odors at the deepest layers. So if you have any questions, feel free to reach out to our office. Other than that, have a great time, and this will definitely keep your bad breath at bay. Thanks.